Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Bah. Today we will discuss about the dental numbering system. So dental numbering system is very important in the field of dentistry and used by the dental professionals and also by the dental students and dental oral hygienist. So it is very important to know the specific number of the specific tooth to give information about the specific tooth. So now we will discuss about this. Before going to start the dental numbering system, which is used worldwidely, we will little know about this primary dentition, milk tooth, and permanent dentition, secondary tooth. So we will discuss about these two. So we know that the milk tooths are the early tooth which are erupted in the oral cavity, and then they are shed on, and then the permanent dentition start erupting, and it remain throughout of the life. So the milk tooths are 20 in the number. The eruption start from the 6th month and still ongoing and reach to the 5th to 6th year, and after that it starts shading down, and till 12th year complete shading occur of the milk tooth, and then the permanent dentation start erupting from the 6th year and ongoing till 18 years or 20 years until the 3rd molar erupted. So the number of the milk tooth are 20 in the number, and we know that the premolars are missing here along with the 3rd molar in the milk tooth. So their number in each jaw is 10 in the upper jaw and 10 in the lower jaw. So the 20 tooths are here. Permanent tooth are 32 in the number, 16 in the upper jaw and 16 in the lower jaw, and also the premolars are present along with the 3rd molars. So it is the permanent tooth are 32 in the number. So now we will come to the numbering system. The numbering system is there are the 3 different numbering system. First, universal numbering system. Second is the Palmer notation numbering system, and the third is the Federation Dentire International system. We will discuss each of them one by one. So now we will come to the universal numbering system. Universal numbering system was adopted by the American Dental Association. It is still used in the United States. Used by most of the time by most general dentists use this numbering system. It is simple, and the numbering start from the maxillary right 3rd molar and continue and end on the maxillary on the left maxillary 3rd molar. So the numbering start from 1 to 16 in the upper jaw, from 3rd molar to 3rd molar, from the right side to left, and then drop down toward the mandibular 3rd molar, and from the 16 number, and it continues and crossing the midline and coming to the 3rd molar right side, mandibular 3rd molar right side, which will be 32 in the number. So it is very simple. Just start from 1 and going completing the upper jaw, and then drop down, and then completing the lower jaw. So it is straightforward, just counting continuous numberings are coming in this one. So here we will discuss about this, we will look to these pictures. The permanent dentition, from number 1 it start from the right maxillary 3rd molar and continue crossing the midline and coming toward the 3rd molar of the left side in the upper jaw, and then drop down toward the left side. So from the 17 it continues to 18, 19, 20, and continue crossing the midline and coming toward the right side of the mandibular. So it is very simple. It is just a numbering system, continuing from 1 to and ending on the 32 like this. And here we will look to the baby tooths, the primary dentition. In the primary dentition, it is simple, just alphabets are used. So we know that the 3rd molars are missing, the premolars are missing. So it starts from the right side of the upper jaw, from the 2nd molar, and continuing crossing the midline and coming toward the other side from the left side, and then drop down toward the lower jaw, and continuing from the K, L, M, N like this, coming toward the T. So it is directly like simple rule starting from A and to J in the upper jaw, and from K to T in the lower jaw. So simple numbering system, just to write a number and it will tell about the tooth number. So now we will come to the Palmer notation numbering system. Palmer notation numbering system is also common most of the time. It is also called Zsigmondy system, used by the orthodontist and pediodontist, and also by the oral surgeon. It is used. So in this system, each quadrant is divided into each jaw is divided into the quadrants. So the whole oral cavity is divided into 4 quadrants. So each quadrant is represented by a unique symbol that is known as L. So here the Palmer, so L is also present here. If somebody tell you about the Palmer notation, so you must remember this is L is here and L will be there, so L system. And each quadrant contain from 1 to 8 tooth. So just writing this unique symbol and represented it in this symbol like that. Now I will tell you about this one. So we know that these are L sign, which is in part the upper right, it will be like this. Part the lower left, it will be like this. Part the lower right, symbol will be like this. So it is dividing in each quadrant. So each jaw is divided in 2 quadrants. So whole oral cavity is divided into 4 quadrants. Now the numbering start here, it is opposite to the universal numbering system. The numbering start from the central incisor and coming toward the back. So it start from the center and going back. Start from the center in each quadrant going back. So central incisor will be 1, and just you will write this kind of symbol and it will be going like here. Now this is in the lower compartment, just the symbol will show that the number, it is that quadrant. So it is numbering from 1 to 8, 1 to 8, 1 to 8. In the child tooth, it is you know that the alphabets are used just within using the same symbol, and starting from A, B, C, D, E. So A will be the central incisor, B will be the lateral incisor, C will be the canine, D will be the first molar, and E will be the second molar. So it will be like this. Now I will tell you how it is used. Most of the time I have seen in our OPDs also that they just in the during the diagnosis they write this kind of symbol. So it is if we divide it like this, it will be also dividing oral cavity into the 4 quadrants and writing these tooth. So now the 5th and the 6th, it is coming in the lower compartment, and it is the right side, it is the left side. So it is the left side of the lower compartment, means mandibular jaw. So these are the left, 5th and 6th. This is the premolar, second premolar, and this is the molar of the mandibular left side. So then you will extract these tooths like this. It is so much simple, used by the orthodontist and also by the oral surgeon. So it is used in the oral surgery. And now we will come to the Pediatrician Dental International System, FDA. It is worldwide used and most commonly used. So it is also called 2-digit system. 2-digit system, FDI. So you can remember by this D, and FDI, D digit system. So the 2 digits are used in this FDI system. It is used in each branch of the dentistry. So the first digit will tell you about the quadrant, and the second digit will tell you about the tooth numbering. So the first digit will tell you about the quadrant, which quadrant is this one. For the maxillary right quadrant is assigned by the 1, maxillary left by the 2, and mandibular left by 3, mandibular right by 4, and the second digit will be start from the center and going toward the back side. From 1 to 8 it will be like this. So here you can see that for the permanent dentition, 1, 2, 3, 4, this is the first digit telling you about the quadrant. Which quadrant is this one? This is the maxillary right, maxillary left. Then going back to the third one is the mandibular left side, and the fourth one is the mandibular right. This will tell you about the first digit, will tell you about the quadrant, and the second digit will tell you about the tooth numbering. It is also like the Palmer, from 1 to 8, from 1 to 8, from 1 to 8. So just there are two numbering, there is no unique symbol, just they will give you like this one. The example, tell the tooth number, which tooth are this is 3 8. So if you remember, the first digit tell you about the quadrant. So the 3 quadrant is the mandibular left side, this is the lower compartment, and this is the left side, so it will be the mandibular. And the A tooth, you know that the A tooth will be the third molar, so it is the mandibular left third molar, and you will give information about that one. So, and 4 is you know that the 4 quadrant come in the mandibular, in the lower compartment, it is the mandibular right, and 4 will be this will be the first premolar. So it give like this. And for the deciduous dentition, it start from the 5th, 6th, 7 and 8. So in each quadrant the 5 tooth will be present. So 10 in the upper compartment, 10 in the lower compartment. So it start from 1 to 5, 1 to 5, 1 to 5, 1 to 5 like this. And the first digit will tell you about the quadrant. So the 5th quadrant is the maxillary right quadrant, the 6th is the maxillary left, and the 7 is the mandibular left, and the 8 is the mandibular right quadrant. So it will be like this. Thank you so much. Keep supporting and join us. Thank you so much.